Good afternoon, everyone, and welcome to another webinar. Now, this one's called Memory Loss and Foggy Heads with CKD. It's presented by the lovely Dr. Veena Reddy, consultant nephrologist at Sheffield Kidney Unit. As always, the webinar is going to be recorded, and hopefully tomorrow morning, round about 10 o'clock, you'll be able to share it or watch again on our YouTube channel. Now, if you have any questions at all, just pop them in the chat box. And then after we've done the presentation, I'll read them out and we'll try and get through as many questions as we possibly can. So let me welcome to the webinar, Veena.
Thank you very much, Pete. Thank you. And I apologize, we're a little bit late getting started. I think that was partly my fault trying to work out the sharing, because I do need to come out to one screen, but I'll explain that. So thank you very much, everybody, for joining us today. And I hope you're coping with this second round of heat wave that we're all going through and trying to find some ways to keep cool. So as Pete said, my name is Veena Reddy. I'm one of the nephrologists in Sheffield. Going to talk about today is something that I think lots of people with kidney disease notice, but they often tend not to mention it. So that could be memory problems, difficulty concentrating, or what some people may term this as brain fog. So this isn't something that people imagine, and it's certainly not a sign of any kind of weakness at all, but it's a very common experience in people with chronic kidney disease. So I'm not a memory specialist or a neurologist, but I do see lots of people with kidney disease, or people who are on dialysis, or people who've had kidney transplants, and it's something that people do ask about. So what I'd like to do today is talk about what brain fog actually is, why it happens, what we know about it, and then more importantly, what we can do as a sort of healthcare team and you as patients to try and help you sort of deal with that. So I should have come onto the Slido screen at this stage. If this is the NHS computer unfortunately doesn't allow me to use Slido directly onto PowerPoint. So I'm just going to stop sharing just for a couple of minutes, but this QR code should work. If I then go on to the Slido screen, so just bear with me, Peter and I did have a go at practicing this, so hopefully this should work. Share. So can you see that? Can you see that Slido screen?
Perfect.
Perfect, brilliant. Okay, so I've just got a couple of questions that I wanted to ask the audience, just for me to get a bit of an understanding about the audience that we have today, and also a little bit about sort of what some of the symptoms. So if I just start this poll, the first question should come up using that QR code, and that QR code is on the left-hand side if you didn't get a chance to capture it. So basically the question is, which option best describes you or the person you care for? And that's at the moment. I appreciate some people with kidney disease might have had a transplant and so on. So options are kidney disease but not on dialysis, you are on hemodialysis, peritoneal dialysis, you have a kidney transplant, you're a carer or a family or a friend, or you're a healthcare professional or other. So I'll just wait for a few more seconds for people to vote, and by all means you don't have to vote either. So we've got about 15 people who have voted, so about 40% are kidney transplant recipients, about a third of the people that voted are not on dialysis, and then we've got a mixture, some on hemodialysis and nobody, I think, on peritoneal dialysis. Okay, so thank you.
Those that are not sure, if you want to scan with your mobile phone that QR code, it will then come up for you, just in case you're not familiar with QR codes. Sorry.
Thank you very much. No, you're fine. You're fine. Thank you very much for that. That's really helpful. So still going up, so I'll just wait for a few more seconds. So a bit of a split really. So majority of either not on dialysis yet, or have a kidney transplant, and then we've got a few people that are on hemodialysis. So the poll will sort of continue, but I'll go on to the next question if that's okay, just in the interest of time. So the next question, have you or the person that you care for experienced any of these in the last 3 months? So forgetting appointments or conversations, finding it hard to concentrate, that's probably all of us in this heat at the moment, losing track of what you're saying, and then feeling sort of mentally slower than usual. And you can choose more than one if you've had more than one of these symptoms, or none of these. Again, I'll just wait for a few moments while people have a chance to vote. Oh, sorry. The other thing I should mention is once you do click on one of these options, you just have to press the send button. Otherwise, it doesn't come through. So that's lovely. So I've got about 22 people that have voted. So sort of a mixture of finding it hard. So probably all of these. Interestingly, very few have experienced none of these. So that's interesting. And then I'll come on to all of that in a minute. So I will stop the poll actually, and I'll leave the poll for the time being. What I will do is stop sharing this screen, if I can, and go back to the presentation mode. Let me just find how I do that. Right, stop sharing, and then I should be able to go back onto the presentation. So, Pete, again, if you could just tell me when I do come back onto the presentation, please, that would be great.
Yep. So you go to slideshow again, and from the beginning, it should work. But it's muted you again.
Can you hear me, Peter?
Yeah, I can.
Okay.
Can hear
Okay.
you, but I can see your desktop and everything at the moment. So
Right. Okay. So let me go to the presentation. So that should, if I go back to the presentation, that should. Can you still
that's
hear me?
it. Yeah.
Perfect. Perfect. Okay. Right. Sorry. We'll move on. So let's start basically by learning a little bit about what we mean by brain fog. So brain fog isn't a medical diagnosis. It's simply a name that I think we tend to give when that sort of that frustrated feeling when the brain isn't working as well as it used to do, a little bit slower. And people might describe things like feeling, forgetting words or losing their sort of train of thought or finding it hard to concentrate. Almost all of us really experience some of these symptoms occasionally, particularly when we're feeling tired or stressed. But the difference is in people with kidney disease, this tends to happen much more frequently. So doctors might call this cognitive impairment, but as I said, it's often more informally termed as brain fog. The symptoms can really vary from being sort of fairly mild and occasional to noticing it more on a regular basis. I'm just going to bring up a pointer option, just so that might help. So this slide looks a little bit busy, but it's basically just a few quotes from people, patients with kidney disease that have sort of talked about how they might describe brain fog. Some of these are from sort of patients that I've looked after or I look after, and some of these are sort of from the sort of the research that I was doing that I came across that I thought would be helpful to share. So this isn't uncommon. So somebody said, I was an avid reader, but actually I can't now imagine making it through a chapter of even a riveting book, never mind getting through some of the sort of the boring but informative sort of material. And that probably is a lot of the information leaflets that we tend to give you, where there's a lot of information, but and we expect you to kind of sort of get through all of that. I walk into a room and forget why I'm there. And again, a lot of us will probably experience that, but it's just the frequency with this happens in people with kidney disease. Now, these three really refer to people on dialysis, and I noticed we had quite a few people, a lot of patients who are on hemodialysis. So some of this might sound familiar to you. So my head feels clearer on a day or two after a dialysis session, finding it difficult to getting through instruction manuals, and don't even try this during a dialysis session. And again, this isn't uncommon, finding it hard to work out what's actually normal aging and what's due to dialysis. And that's probably one of the reasons why I think it doesn't get mentioned as often as it should do. And then this I thought was actually particularly strong, I think. So this person said, I had brain fog for years whilst I was on in-center dialysis. It would usually start midway through a treatment and go on for a few hours afterwards. But actually, my brain never worked fully until I started home hemodialysis. And I'll come on to why that might be. And I can pinpoint the change. I was homeschooling my 3 children, and my ability to teach maths and science improved drastically once I began home dialysis. So as I said, if you sort of recognize, some of what's being said, I don't think you'll be alone. So what are the symptoms of brain fog? So the brain fog really can affect your attention, so finding it difficult to concentrate. It might affect your memory, so you forget appointments, names of people, difficulty with planning, so in terms of sort of organizing your day-to-day tasks, never mind, sort of further down the line in terms of like organizing holidays, etc. Or simply it might just be a sort of a stamina issue. So actually you just get more tired after, having to concentrate for a short period of time. Not everyone experiences all of these. And then some people might notice sort of forgetfulness, whilst others might just say, actually, I feel just exhausted after having to concentrate for short periods. One thing really to important thing I think to highlight is these symptoms can fluctuate. You can have some days where actually you're feeling particularly sharp, and you might go through another couple of days where actually things are feeling much harder, to kind of get through, whether that's at work or actually even on a day-to-day life at home. So this slide basically shows sort of the common symptoms that people describe when they talk about brain fog. So this is a survey of 25,000 people that was done a couple of years ago, and this is people with brain fog, not specifically due to chronic kidney disease, but it could be due to lots of other conditions. And these are the sort of the typical symptoms that people described. So almost all of them said they found it difficult to focus, and therefore probably find themselves getting more irritable. And about 50% of the people sort of said actually the memory is a problem, so trying to remember appointments, and then task orientated difficulties, so trying to finding it difficult to plan ahead. So what about in kidney disease? So people ask, is it actually just, am I the only one that might be experiencing all of, these kind of symptoms? And the answer is definitely no. We think about 4 in 10 people with kidney disease experience brain fog, and that becomes much more common as the kidney function gets worse. And I'll come on to why. The symptoms can occur at any stage. So some people might experience them at very early stages of the chronic kidney disease, and for others, it might not happen until sort of, you're on dialysis, or even much later once you've started dialysis. And then one day can be different to the next day, as I said earlier, because these symptoms can fluctuate. So before we start talking about kidney disease, it's just worth remembering that brain fog isn't just unique to chronic kidney disease. So there's lots of sort of these symptoms or these things that you will recognize in sort of day-to-day life that might contribute to brain fog. So not getting, a good night's sleep, maybe one night of sleep isn't too much of an issue, but actually if that's happening on a regular basis, that will affect your ability to sort of concentrate, and you'll probably all be aware of that. Chronic stress, so whether that's related to home life, relationships, work, or health, etc., that causes sort of this underlying inflammatory sort of state that can lead to brain fog. Deficiencies in nutrients, particularly sort of calcium, zinc, magnesium, but also vitamin B12, folate, and so on. People who do drink a fair amount of coffee or tea you might recognize actually, particularly first thing in the morning. Some people find it difficult to sort of, start concentrating until there is some caffeine on board. For people, for diabetic people, any high blood sugars, but also low blood sugars as well, can contribute to brain fog. Changes in the hormones, so particularly menopause for women, is a sort of a common time when hormonal changes can affect sort of how well the brain functions, but also during pregnancy and conditions like underactive thyroid gland. Mental health conditions, so whether that's low mood, anxiety, depression, all of those has an impact, and then some medications as well. So before we go on to why how, I guess, the kidney disease affects sort of the brain health, it's helpful to understand just very quickly why kidneys are important for the brain. So kidneys filter waste and they remove it through the urine. And I know you'll know all of this, but I've just quickly run through this. But particularly the urea is what we're able to measure, but they get rid of waste in the blood. They help balance fluids and minerals. So if there's too much fluid on board, they get rid of it. And if we're dehydrated, like we might be on a day like this, that they tend to absorb more of the fluid, and again help control lots of minerals, like your sodium, potassium, calcium, magnesium, everything. They also help regulating your blood pressure, and they have lots of other sort of benefits as well in producing hormones that help prevent anemia, bone health, etc. So they support the overall body health. So what happens then when the kidneys don't work very well? So if I just go through this one by one. So as I said, because the kidneys get rid of these waste products, you get a buildup of the waste products when the kidneys don't work very well. We often refer to it as uremic toxins. Because urea is one of the main ones that we can measure. And when these build up, the urea can cross sort of the blood-brain barrier and enter the sort of the brain and the cells. And with that, you get the fluid shift in. So you get sort of a swelling of the brain cells, and that affects how well the brain cells work. High blood pressure. So people with kidney disease are very high risk of getting high blood pressure. And when you have long-term problems with high blood pressure, what happens is the blood vessels sort of become stiffened, particularly the smaller blood vessels, and they narrow, and that reduces the amount of blood flow and therefore the oxygen that's being supplied to the brain. As I mentioned earlier, the kidneys produce a hormone called erythropoietin, EPO, and that's needed to help make the red cells. And it's the red cells that carry the oxygen to all parts of the body, including the brain. So when your kidneys don't work very well, you get less of this hormone, therefore you become anemic, and therefore the brain gets less blood supply and less oxygen as well. With the buildup of uremic toxins and also complications like something called oxidative stress, that can trigger your immune system and cause it to go into sort of overdrive. That results in sort of this persistent low-grade inflammation that's all over the body, but also includes the brain as well. And in that sort of chronic inflammatory state, the blood vessels can become a little bit damaged, but also the nerve cell communication is also affected, and that again leads to sort of what we call that cognitive decline, so the how well the brain cells work. Medication burden, so what we term as polypharmacy, is very, very common in people who have kidney disease. I think studies have shown on average, people with chronic kidney disease are on somewhere between 8 to 12 tablets, and that's sort of a lower end of the estimate really. And some of these medications, or many of these medications, are actually filtered by the kidney. So you can get a buildup of the medication. So particularly medications like codeine, tramadol, gabapentin, morphine, all of those things. It's very important to make sure that you're on lower doses of those, because otherwise they can build up and affect your mental, how well the brain functions. Also, the more medications you tend to be on, the more likelihood that there is going to be of an interaction between the medications, and that can also affect your brain health. And I mentioned a couple of slides ago how important sleep is, to make sure that actually we can function properly as far as sort of thinking is concerned. But there's lots of reasons why people with kidney disease may not sleep as well. And this is I've just picked out 3 of them. So restless legs isn't uncommon, particularly in people who are on dialysis, but also itching because of the toxins building up, insomnia, all of that affects how well you sleep. we've got quite a few hemodialysis patients that have joined us, and again, you probably will recognize some of these things, but brain fog is much more common in people who are on hemodialysis. So estimates are somewhere between 50 to 70%. And that doesn't mean they have it all the time, but because it does fluctuate. But majority of people who are on hemodialysis can experience brain fog. There's a number of reasons for that. So by the time someone needs to start dialysis, the kidney function is much, much lower. So somewhere between sort of 8 and 13%. So the toxin levels tend to be higher. The level of inflammation tends to be much more. And the changes in the blood vessels that I mentioned earlier tends to be more advanced as well. All of that sort of affects your brain health. And then once we start people on dialysis, you get these sort of rapid shifts in both the blood flow and the sort of the amounts of the chemistry, the minerals, I guess, in the body, because the toxins kind of build up. We put you on dialysis, the toxin levels go down and build back up again. So you get these huge swings in terms of the amount of fluid there is, but also sort of the toxin changes as well. And that affects, how well the brain functions. And so that dialysis specific fog that we mentioned isn't uncommon, unfortunately. So what people tend to say is, actually, I just feel washed out after a dialysis session. And that can start almost straight away, sometimes even when I'm on it, and I get better by about the next day and I'm back on, sort of 2 days later. So you're sort of in this perpetuating sort of cycle of what we call that dialysis brain fog. That tends to be more common in the early stages of dialysis, when the body's kind of getting used to these sort of large shifts. But it's also more common in the older population, where I guess they might be dealing with other medical problems, or some of the longer term damage, sort of in terms of the blood vessels and so on, may have already happened. Both under dialysis, and aggressive dialysis can actually make these symptoms much worse. So if we don't dialyze you enough, you have this consistently sort of high level of toxins in your blood that affects how well your brain works. But again, aggressive dialysis, of trying to take off too much fluid, is also not good, because it suddenly brings that sort of the amount of blood pressure, blood flow to the brain, it makes that much worse. And therefore, people where we end up removing large volumes of fluid tend to get or more likely, rather, I should say, to sort of have symptoms with brain fog. It's for that reason, I think we often tend to say, stick to sort of fluid restriction. And if we do need to remove the fluid, sort of we have a maximum that we tend to stick to, that we can take off over a period of time. And if there's more than that, this probably won't be uncommon, that we might say, let's add in an extra dialysis session. Or if it's happening on a regular basis, we might say, actually dialyze more frequently, 4 times a week or 5 times a week if it's in the hospital setting. Now, this is just a crude concept, just to kind of describe that in a little bit more detail, of what we call cognitive function, so the brain function. And this is over time. And this graph basically shows how our brain function declines with age. And as we get older, all of us, less able to remember, memory isn't as good, might not be able to concentrate for as long. And that's common. That gets worse in all of us as we get older. In people with chronic kidney disease, that happens a little bit quicker, for all the reasons that I mentioned earlier. And in people on hemodialysis, you can see, because of, as I said, these fluctuations in terms of the blood flow and the toxin levels, that can happen sort of much more rapidly. And whether if we are under dialyzing, or particularly if there's aggressive dialysis, this can come on much more rapidly. And this is basically how your cognitive function, so the brain function, might change on a day-to-day basis. So it gets worse after a dialysis session, gets better, gets worse, gets better again. This doesn't mean it happens in every hemodialysis patient, but there is a higher chance of not being able to think clearly when you have hemodialysis than with if you have kidney disease before you start dialysis or after a kidney transplant. So talking about kidney transplants, so does the brain fog get better after a kidney transplant? So you could argue, if you actually have a transplant that's working well, with relatively good function, then actually the toxin level should be, should come right down. The kidney should be able to stop making its own EPO, erythropoietin, and therefore risk of anemia is less, and so on. So what we find is in practice that some aspects of thinking, so for example, how you might remember events or the information that you've learned, goes back to normal, but other areas such as sort of how quickly you can sort of think, or language skills do get better, but maybe not completely revert back to how you used to be. But some people carry on experiencing some mild difficulties, and we think that's probably because of earlier changes in the blood vessels that may have already happened, or the effects of sort of long-term, particularly dialysis treatment, that can't be reversed after a kidney transplant. But most people do find that they can think a bit more clearly after a kidney transplant. So, does it matter if if actually we are, can't think as, fast as we might be able to, or might take, twice as long to read a chapter in a book? Well, with brain fog, day-to-day living becomes sort of much more difficult. What we tend to say as, sort of healthcare team is actually, taking control of your sort of health, whether it's physical health, mental health, etc., and trying to manage as much of that yourself gives you that control. You're much more likely to, or much less likely rather I should say, to come in, end up in having an emergency admission, or less likely to have side effects with medications, etc. But when you're faced with brain fog, or not being able to think clearly, actually all of these tasks become more difficult. So we're asking you to take medications, and as I said earlier, minimum, you're on about 8-12 tablets a day, and something you might ask you to take once a day, something once a week, something 3 times a day, and taking all, trying to remember all of that becomes just much more difficult. And then a diet, again, as a minimum, I suspect most people with kidney disease will be asked to be on a low salt diet. But if you're a diabetic with kidney disease, you're on your diabetic diet, and you're on a, particularly on dialysis, then you're on in a low potassium diet, low phosphate diet, fluid restriction, etc. So all of that just becomes more difficult to navigate. And again, attending appointments, not being able to remember them, because it isn't uncommon that you're having to go and see 2, 3, 4 different people. Tracking symptoms. So, you might say, for example, come in with chest pain, and I'm sort of, trying to ask you 5, 6 different questions, because I'm trying to work out by, the answers you give me, whether it might be related to a heart problem or a chest problem. But actually, keeping a track of all of these is difficult when actually you can't think clearly. And also people feel sort of judged for struggling with things that they might have found, easy to deal with. The other thing I think that we get asked often is, am I developing dementia? So the fact that I can't think clearly, is this dementia? So brain fog is not dementia. Brain fog sort of fluctuates. As I said, you can have good days, bad days, but dementia is usually progressive, and it does tend to get worse with time. And lots of the causes of brain fog that we talked about earlier are manageable or treatable. But a caveat to that is people with kidney disease do have a higher risk of developing dementia. But that, again, stress, that does not mean that you will develop dementia. So the reason that it's linked to a higher risk is because some of the conditions that affect the blood vessels, so particularly what we call vascular dementia, where the blood supply to the brain is affected sort of in a long term, it's common conditions like diabetes and high blood pressure that cause this, and that obviously affects both the kidneys and the brain, and that's the reason for that link. But it's not the kidney disease itself that's necessarily leading to the dementia. Many of the risk factors, as I said, are manageable. So particularly blood pressure, taking medications, if you're on dialysis, hemodialysis, not drinking sort of excessive volumes of fluid, and so on. And then lifestyle measures that I'll come on to later on, sort of keeping a balanced diet, exercise, good sleep, and so on. So as I said, there are lots of things that we can help you with in terms of trying to manage your brain health, but there's lots of things also that you can do yourself as well, and I'll go through that in the next few slides. So in terms of your healthcare team, can work with you to try and sort of look at sort of some of these contributing factors. So keeping that blood pressure low. So I think I've stressed a few times how important that keeping that control is to make sure that the brain, the blood vessels that supply blood and oxygen to the brain are not, damaged anymore, and you sort of maintain that oxygen supply. And for that same reason, managing that anemia, making sure, whether that is with iron tablets initially, iron infusions, and then the EPO injections, whether you get them on dialysis or take them at home. So that's important. Optimizing dialysis, as I said earlier, it's making sure you're not under dialyzed, but also making sure that your dialysis isn't aggressive, and that we're not taking off large volumes of fluid, in sort of short spaces of time. Similarly, after a transplant, making sure that we get sort of particularly the medications, I think is correct, because once you have a kidney transplant, you are on anti-rejection drugs, but you might also still be on some blood pressure tablets. You might be on medications for your bone health. You might be on medications to reduce the risk of infections. And again, managing all of that is just really, really important. And again, I've sort of stressed on that in terms of how important making sure we sort of review your medications with you on a relatively frequent basis, or regular basis I should say, getting rid of ones that you don't need. And you might have had problems with indigestion 2 or 3 years ago, but actually if that's not a problem, do you need that medication, particularly if it might interact with another medication? So it's things like that. And then what can you do to support your brain health? So at the very top, I put keeping physically active, and that is very important. And I'll come on to that in a bit more detail. But following that dietary advice, so whether that's a low salt diet to help keep the blood pressure better under control, or potassium, phosphate diets, fluid restriction, and so on. But it's generally a healthy, balanced diet is what's really, really important. Good sort of sleep hygiene. That's anything really, starting from making sure that you're not having caffeine a good 4 or 5 hours before you go to bed if you're struggling with sleep, to avoiding alcohol, tobacco, just before you go to bed, to limiting the amount of sort of screen time on hot days like this. Make sure your sort of bedroom is kept cool, etc. So anything really, and that will be different for different people, but trying to get as good a night's sleep as we can. And if there are symptoms that are affecting the sleep, talk to your doctors, talk to the dialysis nurses about that, and see if we can help you manage that. Taking the medications as prescribed, as I mentioned earlier, and then exercising your brain really, and that could be with anything. So if you like reading, and it doesn't matter that actually you can only read 5 sentences for the time being. You can come back to it when you feel a little bit better again, but that just really keeps your mind ticking along. Puzzles, you might do Sudoku, crosswords, word finding, anything at all, and socializing. And again, whether it's meeting with family or relatives, all of that, sort of improves sort of these what we call these sort of happy hormones, and that improves sort of the blood flow and to the brain, and the brain health as well. And then, if you're struggling despite all of that, making sure you seek support really for any of these symptoms, but also stress, anxiety, mood. That might start from your family, friends, but actually, if you're struggling beyond that, speak to your nurses, speak to your doctors, and that doesn't necessarily mean that we put you on more medications. It could be referring you for some talking therapy, counselling, etc. So as I said, I'd come back onto exercise and brain health. So this is really, really important. Exercise is important for our overall health anyway, for your heart, but particularly your brain as well. And that exercise doesn't mean that you need to go and start joining a gym or running marathons, half marathons, or anything like that. It's anything that you enjoy doing, that sort of keeps you moving a little bit. That could be walking, for about half an hour, 5 times a week. But if you want to do a little bit more, running, jogging, swimming, cycling, any of these things. Weightlifting, just the only thing to bear in mind is if you do have a fistula in your arm, just check that with your doctors before you start doing that. But as I said, it's anything at all that you enjoy. So gardening, actually, if you fancy doing that, again, that just gets you out and about. And the reason why exercise is so important for brain health is because it improves that blood flow to that brain, and therefore the oxygen supply to the brain. That then boosts your mood, reduces the stress, and improves sort of how well you can think and how well you remember things, and then slows down the rate at which sort of all of this gets worse. For your general health, any kind of exercise can help sort of with weight management, and that helps with your blood pressure control, but also in sort of people with diabetes, it helps with sugar control as well. And again, this improving strength and stamina is really, really important in, as we get older, sort of maintaining sort of your bone strength and your muscle strength is really important to sort of try and take us through our, that's any of us really from about 30 onwards. So, but definitely, once you're sort of, 50 and above, this is really, really important. So there's lots of places where you can access some help with information about exercise, and I've just included a few on here. So Kidney Beam, this might be something that you have heard of or that you have used. So this is an online platform with lots of information in there about for people with kidney disease, all levels of kidney disease, really, from whether you've got stage 1, stage 2, but all the way up to if you've had a kidney transplant. And it gives you information about exercise. There's online classes, pre-recorded classes that you could join, but also help about nutrition, help about lifestyle measures. And these programs are sort of led by professionals, so physiotherapists, dietitians, psychologists, doctors, etc. The hope is that this will be available to every patient with kidney disease, but I think at the moment, not all, depending on which kidney unit you belong to, not all renal units are sort of signed up to it. So if you just put Kidney Beam on a Google search and ask to register, it will ask you for which unit you belong to and then your date of birth, and then hopefully if your unit is sort of registered on it, you should be able to access everything. If not, I would maybe speak to the team at your kidney unit. And if you can't access that, or as well as, there's lots of information on Kidney Care UK with videos, but also sort of free resources about exercise, as well as sort of guidance about healthy diet and so on. I should have maybe put this at the beginning. Peter, realised that's an old logo that I've used, but this is from NKF. Again, there's guidance on safe physical activity, and then this is something that actually NKF is very, very good at, which is providing some peer support program about tips with sticking to exercise. And that's something I suspect many of us sort of fall foul of, that you have this plan to start sort of doing your exercise or diet regime, and after in a few weeks, sometimes even a few days, you kind of fall foul of that. So how tips on how we might stick to that. So there's plenty of information on there. And again, you could speak to your own your team, kidney team, whether that's in the dialysis unit or transplant. In Sheffield, we often refer people to this weight management program called Move More, but that's available for people with chronic conditions, not just with kidney disease. Some dialysis units also offer intradialytic exercise. Sheffield used to, but at the moment, for lots of reasons, that's not happening. But that might be something that you might want to ask about. And then away from exercise, there's lots of sort of habits, I guess, that we can develop to try and reduce the amount of sort of pressure, stress on the sort of the brain. So keeping to routines, leave whether it's your car keys in the same place all the time, so your brain's not having to think about where did I put them the day before. Making sure you write lists, using calendars for reminders, focusing on one task at a time, trying to do things that might need more attention, like dealing with bank accounts or paying bills, etc., when you are at your sort of sharpest, and doing things that require less concentration, like I don't know, folding your laundry or something like that. When it might be a time of a day when brain fog is sort of more likely. And in terms of, I guess, managing your sort of health, the self-management, so reducing the mental load of that. If you're struggling to remember, taking sort of medications, speak to your doctors or chemists really about the set boxes or blister packs. Use whether it's on the phone or in notebooks, sort of keep reminders of medications, appointments. Bring people, to appointments, because there's a lot of information sometimes given in these, and it's not uncommon. As I said, for most of us, even when we're well, I think we walk away with about 10-12% of the information that's provided to us in a consultation. So again, add in the fact that you actually might not be on top form at the time because for whatever reason, or you suddenly hear something actually that you weren't expecting, or some bad news, you take in even less of that, and that's normal for anyone. And then, if you're not sure, actually ask, whoever it is that you see, whether it's a doctor or a nurse, a dietitian, psychologist, ask them to repeat key information, and at the end to make sure that you do understand. And if need be, ask, for some written information on plain language, particularly if there's, lots of sort of medication changes. That might be something common for, like, if people end up on steroids and we give, reduce your dose on this day, this day, this day, and so on and so on. So ask for written information. And then, speak to your healthcare team, really. So if you're experiencing these symptoms, speak to them, because feeling supported often improves coping. And when you feel you're coping, in the way with which we sort of view our symptom burden becomes slightly better. And, that kind of affects our mental health as well. And if you are a hemodialysis patient, which I know quite a few of the audience today are, and you're getting these symptoms associated with your dialysis sessions, mention them to your dialysis nurses, your dialysis doctors. And there's lots of additional support that we can sort of pinpoint you towards, talking therapy, counselling, peer support groups, as I said, and that might be something that I think, Pete may want to comment on. I know at the end, as I said, NKF do, fantastic work on that. There are some conditions, sometimes when it may not be brain fog related to kidney disease, and you need to be aware of that. So you might need to seek some urgent help, because it might be something much more serious than that. So if there's sudden onset of confusion or disorientation, or feeling sort of drowsy, or signs of a stroke, so new onset of weakness, facial droop, difficulty in speaking, changes in your vision, or a severe headache that's unusual for you, or new hallucinations, or if your symptoms start very quickly after any medication changes. So all of these might point towards something more serious. Not to say that brain fog isn't, but it might be something that needs to be dealt with much more acutely. So that's important to remember. Key takeaway messages. This is almost my penultimate slide. So brain fog, whether we call that sort of slow thinking, difficulty concentrating, difficulty with memory, it's common and it deserves to be taken seriously. The kidney brain link is real for lots of reasons, including the blood vessel health, inflammation, anemia, affecting sleep, and medications as well. People on hemodialysis may be at a higher risk. It doesn't mean to say all hemodialysis patients will have this, but they can be at a higher risk, and symptoms can sometimes worsen around the treatment sessions. So having support for that just makes day-to-day life easier and less exhausting. So we need to be supporting you, and so it's really important that you talk to us about it. And as I mentioned in the last slide, sudden confusion or rapid worsening needs sort of an urgent attention, and you shouldn't sit on that. I'm going to skip past that Slido, actually, just in the interest of time, and finish, because it was just going to be to ask you if you felt actually my beat.
Thank you ever so much, Veena. Really.
Sorry, all went very quiet, so I suddenly panicked that I'd lost you all of this time.
Your signal broke up, but it was absolutely fine. But
okay.
Thank you ever so much. Really informative, and I'm sure that there's not a single person in the room that can't relate to something you've spoke about today. So we have got some questions, if you wouldn't mind taking some. So you spoke about hemodialysis. What about PD? Because you spoke about PD.
Yeah, so absolutely it can do. I guess it's less commonly reported, particularly in studies. The fluctuation in terms of the toxins tends to be much more mild, compared to hemodialysis, where I said you get these big sort of swings with toxins building up, coming down, and so on. But obviously all the other factors, such as anemia, such as high blood pressure, all of those are still there with PD patients as well. So absolutely. So it doesn't, because someone's on peritoneal dialysis rather than on hemodialysis, it doesn't mean they're not affected, but there are specific reasons why hemodialysis patients might be.
Now, you spoke about sleep, sleep being very important, and many kidney patients produce, if they're not on hemodialysis, a lot of urine overnight. They end up having broken sleep, going to the toilet, restless legs, things like that. Is there any tips to avoid that apart from don't drink any fluid before bed?
Yeah. It's difficult, isn't it? Yeah, I mean, obviously not all kidney patients, particularly towards the end, will pass much urine anyway, but absolutely. So it is trying to avoid the simple things that you can do yourself is, avoiding caffeine, or teas and coffees, because they do act as a diuretic. So sort of later in the evening, so maybe stop by about 2 o'clock. So this is, I guess, to do with the sort of the having to get up to go to the toilet. In men, it may be related to sort of prostate problems, actually not related to the kidneys at all. So speak to your doctors and nurses about this. If you're on any water tablets, don't take them after about midday. So the first one we usually say first thing in the morning, and the next one no later than about 2 o'clock. So make sure you're not taking water tablets sort of later into the night. So those are the kind of the simple things that you can do. But particularly with having to pass more urine, as I said, if it may be related to other conditions like enlarged prostate, or it could be actually have a urine infection. So if you've kind of done the sort of the simple things that you can think of and it's still a problem, make sure you speak to your doctors. In terms of restless legs, absolutely. Again, it's sort of having that healthy balanced diet to make sure that you're not sort of deficient in sort of nutrients. If making sure, again, speak to your doctors and nurses. So iron deficiency is can be a common cause of sort of restless legs. And again, people who are on hemodialysis tend to experience that more than actually other conditions for other sort of chronic kidney disease for some reason. But again, there are medications that we can give to support that. But yeah, I guess the simple sort of things that you could do. Again, things like massaging the legs, making sure you're not in too hot a room, etc. In terms of having that sleep hygiene.
Excellent. Next question. I have had 2 transplants over the last 35 years on various medication, and read all these side effects that is me, he says. I'm not be able to think straight. At times, I can't even think at all. Low concentration, frustration, fatigue. I've been to the doctors, not getting anywhere. I'm at a loss.
Oh, I'm sorry to hear that. Um, yeah, it's difficult to know. I think I would probably just keep trying, actually. I mean, is it that they've looked at everything and there isn't anything that they can do, or is it actually they've said actually it isn't anything to do with the medication? So it's difficult to sort of comment too much about that. But I think again, I guess if the transplant kidney is failing and the toxins are building up, whether some of it may be related to that, but definitely if you're on a lot of medications, it's worth speaking to the doctors, actually, even if they've said they might not be able to help, to say, actually, can we just go through the medication by medication? Do I need to be on all of these? Is there interactions? But I'm sorry you're struggling with all of that.
Yeah, I think the advice is just keep trying with your doctor, your renal unit.
Yeah, absolutely.
Next time you speak to your consultant or something like that, just keep plodding along.
Yeah.
And on the subject of, memory loss and things like that, someone's put, I take a notebook with me to my appointments. I have lists of lists, which is a great idea. Then we spoke about exercise and Kidney Beam. Kidney Beam is free to all kidney patients at the Royal Free Hospital in London, so that's good. Someone else has put exercise during heat waves is challenging. Any
Yes.
tips? And someone's put a tip in there, actually, so save you answering, Veena. Go out early mornings or late evenings for walks. Someone's also put they work full time, but make sure they walk at weekends.
Yeah.
Um,
Yeah,
and then
it's anything really. If you're working and you're getting the bus, or going in the car, could you stop your car, or get off the bus a mile before, half a mile before? It's anything that you can just fit into your day-to-day routine, rather than trying to go out and sort of come up with some new routine that we all find more difficult to stick to because we are all busy.
And then another bit of information, York has a dedicated physio team, very helpful on the program. Not sure if it exists everywhere. It is a bit hit and miss, isn't it, Veena, really?
It is, unfortunately, the staffing is difficult everywhere. And this is one of the reasons why I mentioned earlier we had an intradialytic exercise program in one of our dialysis units. And it was the lack of sort of the physiotherapy support because of all the staffing issues that kind of, has sort of come to an end at the moment. But yeah, you're very lucky if you've got dedicated physio support, actually. So make the most of that. And I think we just need to try and keep making a case, to have more of our units with that support, really.
And then I looked and saw we've got masses of other messages, but then I read them all, and a lot of them are saying, "Thank you, Veena. That was amazing. Thank you for the webinar. Really do appreciate um, recognizing brain fog and everything else." So lots and lots of people have, thanked you for this great webinar, and it brings it nicely to a close, actually, because we have run out of time. If we didn't get round to your question, I'm really sorry. Time got the better of us. Our next webinar, date for your diary, is September the 2nd, and that's Patients Know Best. So look at our In Touch magazine and everything else, and you'll get more information about that. But that's September the 2nd. This webinar has been recorded, so you'll be able to watch again from tomorrow on our YouTube channel and share it with friends and colleagues and people you see at the clinic and everything, because it has been extremely useful. So have a lovely evening and thank you very much.
Thank you very much.